Hello, my name is Dr. Steven Batash. I'm a board-certified gastroenterologist. I'm a clinical assistant professor of medicine at New York University Medical School. Tonight we're going to talk about bariatrics, or in simple language, it's weight loss. And specifically, it's endoscopic weight loss, not surgical weight loss. And we're going to discuss the Orbera intragastric balloon. In this country, this balloon has been available for a little bit over a year. However, this is not a new procedure. In Europe and in South America, they've been doing this for over 20 years, and they've done over 220,000 procedures. So we have a lot of experience with this balloon, and the experience tells us that the balloon is safe and the balloon is effective. On average, people who do this procedure lose between 30 and 40 pounds. Having said that, just in my own personal experience, I have 3 people who lost 45 pounds, I have 2 people who lost 50 pounds, and I have my champion, 1 person who lost 55 pounds. But on average, 30 to 40. The balloon is meant for people who are moderately obese, not morbidly obese. In this country, that's defined as a body mass index between 30 and 40. What the balloon does is it allows you to lose weight. It allows you to lose weight in 2 different ways. One way is it's what we call constriction. In other words, if a normal stomach holds this much food, once you have the balloon in there, whether you like it or not, you will only be able to put in this much. And if you put in more food than this much, you will vomit. So it makes you eat less food. It decreases the portions that you can take. The second way in which the balloon works is it keeps the food in the stomach for a prolonged period of time, thereby keeping your stomach full for a long period of time. And that sends a signal to the brain saying, I'm full, I'm not really hungry, I don't want to eat. The procedure is meant for people who are highly motivated, people who have tried on numerous occasions to lose weight and who've been unsuccessful. So we want a motivated person who needs an extra push or a springboard to succeed. And that's what this procedure is. It's a push. And we take a person who's highly motivated and we allow him or her to be successful. In order for the balloon to work, it is not enough to lose weight as long as the balloon is in the stomach. In order for us to be successful, the weight has to stay off after the balloon is removed. We keep the balloon in for a period of 6 months. And during this 6 months, we are training or brainwashing your brain to behave in a more conscientious way. So we're training your brain to be satisfied with a small portion rather than a big portion, number 1. And number 2, we're going to train you through nutritional counseling in terms of what foods to avoid. And it's important that this procedure, in order for it to be successful, what we're really doing is we are redefining your relationship to food. If we are successful after the balloon is removed in 6 months, what will happen is as follows. 1, this much gets you full. You don't no longer need this much. And if you see something greasy, something fattening, if you see chicken wings, you're going to look at it and you're going to say, this is disgusting. How can a person put this in her stomach? If we've done that, that means we've retrained your brain, and you're going to be successful, because the training that you've received during the 6 months, you're going to have to continue it for the rest of your life. You can't say that after the 6 months you're going to go back to the way you've eaten food before. That's very, very important. Now, The balloon is kept in for 6 months. The balloon is very sturdy. It looks like a breast implant in your stomach. The contents of the balloon are normal saline or salt water, okay? And this prevents you from eating too much. But like I said before, it's not enough to just eat less. We have to teach you how to eat right and to stay away from foods that are fattening. And as I said before, if we're successful, you will never go back to your old habits of eating. Now, the beauty of the balloon is that the weight loss is achieved not through surgery. We just do it through an upper endoscopy. There's no general anesthesia. We don't cut anything. We don't change the plumbing. You don't end up with an incision. It's an endoscopy. The procedure takes about 15 minutes to do. A patient goes home the same day, and then they enjoy the weight loss and the new knowledge that they've acquired in terms of how to relate to food in the future. It's a very safe procedure. It's an effective procedure in the right patient. You have to be motivated. If a person is not motivated, they should not waste their time. But for serious people who are motivated, this is a very serious and very effective way to lose weight without subjecting yourself to general anesthesia, without ending up with any scars, and without tolerating the side effects of surgery. It works. Please get yourself educated and learn more about this procedure.